Hello pumpkins! Before we get started, there are some caveats and content warnings that I need to make. We are going to be talking about the deliberate termination of pregnancy. This is not opening up a discussion about pro-life versus pro-choice versus Roe v. Wade versus right to life versus forced birth. That's not happening on this channel. The reason I say that, no one's mind is going to be changed by a YouTube video. Everyone has their own views, everyone is very staunchly entrenched in this, and I have my own views which I'm going to express in this video. The chances of this video being monetized are very, very slim because of the subject matter being so sensitive. And I think it's an important message to get out, not just because of the clicks and views, but because I think that this is important health information for those who are experiencing an unwanted pregnancy. Because YouTube doesn't like the abort word, I will be using the terms induced miscarriage or termination of pregnancy to stand in. Of course, in discussing that, if you are not in a place where you can handle talking about the termination of pregnancy, talking about induced miscarriages, because that is a very sensitive subject which so many women experience, please do watch something else. I don't want to trigger anyone, and I want everyone to really take care of themselves. I do understand that pregnancy doesn't just affect women, that anyone with a uterus can get pregnant. This includes trans men and non-binary people. Although those taking hormone therapy are often rendered infertile, I do think it's important to include them in the discussion. But for shorthand, I am going to be saying women, and I am going to be saying she, her. I just want you to know that if you are a trans man or you're non-binary, I see you. I do understand that you fit in this conversation, but to say persons with uteruses every time I want to say woman it's a mouthful, but it's not meant out of disrespect for the trans community. We are allowed to disagree on things, and I know where you're coming from. I was anti-choice, pro-birther for a good part of my teen years, and so I know the arguments. I understand fully where you're coming from. We can talk about other things that we do agree on, and just agree that this is not the platform to discuss reproductive rights. Lastly, I am going to be discussing herbs, herbal remedies, and known medicinal uses of herbs. I am not a doctor. I am not giving you any sort of medical advice. Do not take any medication or herbal remedy without consulting a physician. Now that that's out of the way, let's get to the video. I wanna have on that avenue. I wanna have on that avenue. Come on. Humans have used medicinal plants, well, as long as there have been humans. And certainly there's powerful wisdom and powerful magic to be learned and gained from these plants. For most of humanity, that's all our ancestors had to fight the diseases and infections that ravaged the human body. Some of these worked. Some of these could be very effective. But some had terrible consequences and side effects, and some weren't effective at all. It was a time of trial and error without the rigors of the scientific method. We worked with what we had. As we started to learn more about the world around us, we started to be able to isolate certain chemicals that were a part of particular plants. And then we could concentrate them and have a regulated and more predictable dose. We could then test these doses and see how well they benefited those who took them. The bark of the white ash became acetylsalicylic acid, also known as aspirin. Berries from the yew tree are used to create powerful anti-cancer drugs. We continue to synthesize and combine many plants from all over the world to create new drugs and new treatment for our illnesses, both to extend and to improve our lives. It can be easy with the discovery of so many drugs that are tested and safe to reject herbal medicine and herbal remedies altogether. Some home remedies are just wives' tales. Sometimes they don't work at all. Or they can have such a small effect that they're practically useless. However, some herbs and plants have been shown to have significantly powerful benefits. Garlic can have protective factors for those who are at risk of stroke or heart attacks. Cranberry, when taken in large quantities, can prevent bacteria from sticking to the wall of the bladder, and possibly even prevent bladder infections. It's important to note that natural doesn't equate to safe or better. After all, the deadly nightshade plant has medicinal qualities when the atropine is removed, measured, regulated, and concentrated. But obviously, no one should ingest nightshade berries without knowing exactly what they're doing. Many fungi and mushrooms can be delicious, but without proper skills, others can be deadly. It's not a good idea to risk unless you can really tell them apart. This is why the knowledge and training of herbalists are so important. This was often a skill that was passed down through apprenticeship from one healer to another, from one generation to the next. Most of the big healing, the major healing, was done by men. Anatomy was first learned on the battlefield. Broken leg, skull fracture, lungs crushed. It was a male doctor who would fix you. But they considered themselves above the delicate matters of women's health. They thought that women's reproductive issues were just kind of icky. Men didn't deliver babies. That was the job of the midwife. And men certainly couldn't be bothered to deal with the issue when their mistress became pregnant. They would send her to the cutwife. The cutwife was a tradesperson, a tradeswoman, sometimes also the midwife, who was trained in dealing with the specific thing, the termination of unwanted pregnancies. This was often an older woman. She was considered an outcast. She made her living off of the wealthy men in town who sent their mistresses and prostitutes to her. And she did, well, what a cutwife needed to do, namely to end the unwanted pregnancy with a sharp blade in the cervix. She was reviled, but yet her services were so essential. It was very common for the cutwife to be accused of being a witch. Whether or not she was a witch is irrelevant, because she dealt with such matters as women's fertility and did the dirty job that no one wanted to do and no one wanted to think of. She would often be subject to the interrogations by the inquisitors, and if interrogated, found guilty and executed for being a witch. This is another reason why I don't use the word witch. There is a video coming on that. I've recorded it 3 times now, and YouTube doesn't like when I talk about the truths of our history and of the word witch. It'll come out, I promise. Sometimes, though, if the pregnancy was in early stages, the cutwife might be able to give her an herbal concoction. I don't want to use the word potion, let's say tea. Some of these herbs could be quite powerful and very toxic. Herbs like pennyroyal, tansy, American red cedar would be used to create this tea that could cause a miscarriage. But this was risky. These were poisons. It would have been tricky to make the body dispel the fetus without killing the patient. Sometimes the herbs were too strong and the pregnant woman died. Or sometimes the herbs were too weak and the cutwife had to, well, cut. In modern times, in many developed countries, we value the lives of women, and we have safer ways to terminate unwanted pregnancies. Instead of going to the cutwife or the back alley coat hanger, we have clinics run by doctors who are trained in the best way to care for their patient in the event that she needs to terminate a pregnancy. Most terminations happen before the 12th week and are typically now done at home with hormone-based medications. Once consumed, bleeding typically starts within the hour and the fetus is dispelled. A blood test is then performed in the following days to ensure that the patient is no longer pregnant. Should the medication not be effective or not be an option, then the surgical procedure would be performed. But unlike with the cutwife, the procedure would take place in a sterile environment, and the patient may have the option of pain medication or sedation. But for many women throughout history, and even today throughout the world, the clean, professional clinics run by trained doctors are not available. And with the recent United States Supreme Court ruling that overturned Roe v. Wade, thousands of women will now be forced to resort to these older, more barbaric, far more dangerous methods. The terminations of pregnancies will still take place at the same rate, but now, as in generations past, the body count will be much, much higher. Across social media, the call went out. Herbalists, we need you. We need your skills. We need your knowledge now more than ever. And although I do think that the knowledge and wisdom of herbalists is essential, please do not take herbs to induce a miscarriage. Just don't. At best, they won't work at all. At worst, they will kill you. So what do you do? I wish I had an easy answer. I mean, the easy answer is reproductive rights for everyone. But that has been stripped away for so many. There are those who are still fighting for you, though. For instance, there's an organization called Women on Waves. There's actually a documentary on Netflix called Vessel that's about women on waves. I will leave the link below. It's an organization that's run by doctors. It was started by a Dutch doctor, and she would bring a boat to port of countries that had outlawed the termination of pregnancy. She would then take her patients out to international waters and perform the procedure. Now, however, with the medication that is hormone-based to induce a miscarriage, this can be done by mail. However, it does need to be taken as early as possible, and once a certain threshold has been crossed, the hormone medication is no longer an option. The first step really needs to be to go to your doctor and explain the situation and explain your wishes. There is somebody to help. There is always a way. I want you to know that you're not alone in this and that there is someone to help you. Most importantly, we need to work together and continually fight for reproductive freedom and bodily autonomy. No one has the right to tell anyone when they must become a parent. Is basic health care and should be a right. If you are currently experiencing an unwanted pregnancy, please see your doctor. They will be able to guide you towards the next steps. But please, with something this serious, don't see an herbalist. Don't take herbs to terminate a pregnancy. There are better options and there are safer options. Thank you so much for watching. Don't forget to subscribe on your way out. Please do share this with other women, and may you pray with a good fire. Bye, pumpkins.